Goggin. You may be watching this on my Energy Life Wellness Community course about how to control pain, how to reduce pain. This is going to be going over the alternative and complementary methods for reducing headache. Everybody, if you have a really bad headache, it's a good idea to get it checked out by your doctor. But there's all other ways to help headaches besides medication that you want to know about because it can be quite helpful. And there is evidence behind these. And so I wanted to quickly go through some of the things that you may not have thought about yet to get rid of headache. The first thing that I would say is that many different things can cause a headache. And if you have a really bad one, you probably need to go and be seen, especially an explosive headache. You need to be seen by a medical provider. And so what I'm going to do is I'm going to start off and just touch on the things that have been supported by research studies and recognize that some of these are have strong evidence, some have weak evidence, but they are not likely to be harmful. Okay. And so beginning, the first thing that I would say is if you have a headache that's ongoing and nothing seems to get rid of it, and you have not yet tried having an acupuncturist help you out with that, that is something that there's definitely evidence for. There are nice randomized controlled trials showing improvement in headache with acupuncture. And, you want to find somebody that you trust. And I think that, looking for recommendations from friends is a really good way to go. But acupuncture is the first one. The second thing that is interesting, and this caffeine is totally a double-edged sword. And, many people, caffeine can cause a headache, and a little bit of caffeine can help a headache. It is something that, as you know, if you drink a lot of caffeine and you come off of caffeine, you may get a headache. And that's the reason people thought, oh, well, maybe this would help headaches. Caffeine is interesting because, we think of caffeine and coffee all in one, little cup together. But coffee itself has many health benefits. And this is trying to separate caffeine from the coffee aspect because, I consider coffee to be kind of a health food. But in some people, caffeine, and let's see, the dose that they used was 130 milligrams of caffeine seemed to help over-the-counter analgesics. So if you're taking things like Tylenol and ibuprofen, which I generally do not suggest because they have other effects, side effects, but a cup of coffee may help your headache. The next thing is manual therapy, looking at chiropractic as a treatment for headache. There has been evidence showing that this could be helpful. I mean, you are all connected. And I'd also like to put a plug in for craniosacral therapy, although I didn't specifically find a meta-analysis on craniosacral therapy. I've had patients who have had subtle manipulations of the head and neck to try and balance things that have found improvement with craniosacral therapy as well. So we don't think about, oh, maybe a chiropractor will help our headache. You sort of think of that for musculoskeletal things. But this might be something if you have not yet tried it and you're struggling with headache. So make sure you're all in line. Now, looking at exercises, I wanted to put this because the neck and head are so associated and neck issues can create problems with the head. Thinking about exercises for mechanical neck disorders to see if that will improve. And this is looking to see if with acute neck pain, it was helpful. But interestingly, the kind of things that they definitely found helpful were strengthening of the neck muscles, the shoulder girdle, and stretching exercises. They also noted mindfulness exercises like Qigong seemed to improve function. Also, breathing exercises seemed to help. Feedback exercises where people were doing certain patterns to see if they could find a way to create a reduction in pain. So interesting. I like that the breathing and the mindfulness helped. So you might consider strengthening this area as a way to improve head and neck issues. This is one of my favorite areas, neurostimulation, right? That's like energy, because I believe that the new medicine is going to be light and energy, y'all. I heard it here. But neurostimulation, directly stimulating a nerve, usually through like through the skin, right? You'll put like a magnet over it, has been shown in, these are small studies. So this is still kind of a new area, small studies, that it can make a difference, especially when people have intractable craniofacial pain. So this actually looked at, okay, so there's different places that you can stimulate, and this is something you have to go to a practitioner for, but it's worth looking into if you are having terrible headaches or problems with, the trigeminal nerve. That could be something that could be helpful. Also, frequency-specific microcurrent. This has been shown to be helpful in my clients. There's not a big study on frequency-specific microcurrent in headache, but that's like an N of my practice. Nutraceuticals, right? Many people would rather take like an herbal therapy rather than or rather than a medication, and that's because, as a functional medicine physician, we are trying to see if we can do things that will help the overall system instead of suppressive therapy, right? Things that like knock out your prostaglandin production. So some of the herbal treatments are going to do similar things to analgesics, right? But when you're giving somebody something like riboflavin, which is B2, or CoQ10, magnesium, vitamin D, melatonin, these all have been shown in a small way to improve headaches. And, what's nice about them is they tend to be very well tolerated. These days, there's a little less interest in medical cannabis because there's not as much safety data there. The other thing is cognitive behavioral therapy, biofeedback, mindfulness interventions. And I talk about the Curable app a lot. The Curable app is something you can get on your phone, which is great for just chronic pain syndromes in general, and certainly for headaches, because a lot of the pain circuitry it can be controlled by where our attention is placed. So if you haven't, but that takes effort, right? Many people want to just take a pill. If you're truly interested in like saying goodbye to headaches, it might be worth considering looking into like the Curable app or cognitive behavioral therapy. The Curable app is pretty cheap. And if you reach out to me, I can give you 6 weeks free. So this is something to consider. And then riboflavin, CoQ10, magnesium, vitamin D, and melatonin have been shown to be helpful in studies. All right, moving right along. This is an abstract from the British Medical Journal that reviewed, it's a review article from 2017, looking at the different complementary alternative ways to improve. And one thing I haven't mentioned yet that I know that they look at within this article is food. Food can trigger migraines, and most people who have migraines are aware of this. And this is something worth looking into. And usually when I see somebody in the clinic, I would have them keep a headache diary to see if they could associate any specific foods. I mean, things like cheeses, alcohol, and sometimes even things like gluten. So if you keep a food diary that associates, when you're eating and when you get the headaches, this is helpful in some people, and to avoid the food that triggers it. I would usually say an elimination diet could be helpful there to try and figure out, like, what if you do an elimination diet where we take out the big things that are triggers for symptoms, and then see if your symptoms go away, and then slowly add them back one by one. And the emphasis on slow there. So an elimination diet might be helpful for people who are suffering from headaches. The nice thing about these types of things is that nutrition therapy, especially when you're moving towards a healthier way to eat, is very, very safe, right? It's very safe. And of course, we know that yoga, acupuncture, massage, biofeedback, and meditation all have a positive effect on migraine and tension headaches. Thank you, British Medical Journal. So if you are a physician and you are not prescribing these kind of things first, it's time to jump on board, okay? The next, there's another nutraceutical. This one just goes more deeply into, the level of evidence. I mentioned herbals. Feverfew is the herbal therapy most commonly used for headaches, and there is some degree of evidence that says that could be helpful, feverfew. And you take that like in a tincture. Okay, let's see, going on through. This is a good review article that talks about all of the different ways. The other thing that I want to, I'm getting to green light. This is very interesting. Some students from, I think from Harvard, made this green light that sits on people's desk and was shown to reduce migraines. So this is a small study here, and I don't know if this is put out by the kids, by those students, but green light, and you can get the green light on Amazon. It's pretty cheap. Just sit it on your desk for a few hours a day, and that has been shown at least a little bit to be helpful. What we understand is that light is a therapeutic, and that is also why I've had people who've tried everything for their migraines, and then they tried the X39 and the Eon, the phototherapy patches that I talk about a lot, and it resolved their migraines. So that is also something, if you haven't thought about putting on a LifeWave patch to see if it'll help, might be worth doing. Reach out to me and I can tell you how to find that. But green light on the desk. Another article, this is 2012, so a little bit older, talking about butterbur and feverfew. Feverfew it pops up in literature more often. Also, I love this article that I came across. Let's see if this is it. Aroma acupoint therapy for symptom management with adolescent patients. So what they did is, like the school nurse had a protocol using aromatherapy, and this is not specific for headache, but I could not find. In fact, they did a meta-analysis looking at aromatherapy and migraine, so specific kind of headache, and it did not show benefits. So this is a little different. This is using acupressure and aromatherapy in school when the kids didn't feel good. Now, so this is very small, but I want to find that. Okay, there's a graphic here that I like. So this is, if this is like a calming therapy sequence, 1 drop essential oil on the tip of the finger, and then apply pressure to these different acupressure points. So you don't have to push really hard, just a light touch. And you have bergamot up on the ear, up in the top part of the ear, lavender right in that part of your hand, chamomile in between the first two toes, a little bit down, and you can look at you guys should check out this article. Lavender on the wrist, 3 finger breaths above, as they show in the article, and then behind the ankle. So I thought that was interesting. And they said 8 out of 15 of the students that used this calming therapy had improvement. And there's another one, strategy. Okay, it's the same strategy. Okay, so I just thought that was pretty cool. Lastly, yeah, here's that. Essential oils as an alternative treatment for migraine headache. Oh, it unfortunately didn't work. Wouldn't it be nice if you could just breathe things in and the migraine would go away? But I think that it's helpful to understand that you don't necessarily have to be taking ibuprofen and Tylenol. There might be another way. I strongly suggest trying things that have no side effects, like the X39 patch, the Eon patch, light, some of the featured supplements might be worth trying, right? These days, they do have they have new medications for migraine, which, I guess I need to certainly bring up. And they have an injection that you can take that it's been shown to prevent migraine, but by blocking a very specific pathway in the pain sequence. And the problem with an injection that lasts a month is once you put it in there, it's in there, right? So if you have a reaction to it, it's like too bad for you. And I think that while a headache is one of those common things that we lose work. I mean, people lose days of their life to headache, and it's so important to find something that can work for you. So I hope that this has been a little helpful, and I'm sending you guys big love. And I'm actually coming to you right now from Mexico, and I'm trying to really breathe and exhale. Remember, breathing and mindfulness can help with headaches. So I'm going to try and make sure that's a headache-free week in Mexico, and I hope that it's the same for you. So I'll see you guys later. Have a beautiful, beautiful day.